Good morning, everyone. My name is Professor Pauline Maki. I'm Professor of Psychiatry, Psychology, and OBGYN at the University of Illinois at Chicago, and a proud member of the Executive Committee of the International Menopause Society, where I serve as Secretary. It's a great pleasure for me to be hosting today's webinar. This webinar has been supported by an unrestricted educational grant from Besson's Healthcare. Besson's Healthcare had no role in the selection of topics or speakers and has not vetted or reviewed the content of the speakers' presentations. The topic of today's seminar is Closing the Global Health Gap for Women. We have two outstanding speakers today who are going to give us a perspective on the global landscape of women's health. What I'd like to ask our audience to do today, just by way of introduction, is to please put your name and your country of origin into the chat so that our two guests can see the representation that we have across the globe here at the International Menopause Society. So just say in the chat your name and where you're from. If you happen to be a member of a council of affiliated menopause societies, please also put that in our chat. And without further delay, I would like to introduce our first speaker, Amira Ghouaibi. She will be speaking on closing the women's health and menopause gap. Based in Geneva, Switzerland, Amira is a passionate and dedicated public health leader committed to closing the women's health gap worldwide. With over 15 years of experience in global health care, women's health advocacy, strategy, and partnership management, Amira has established herself as a driving force in shaping impactful policies and initiatives that empower women and girls. As the head of the Global Alliance for Women's Health at the World Economic Forum, Amira leads multi-stakeholder collaborations that bridge policy gaps, enhance responsible finance, and drive systemic change in global health. She's a partner to us all in ensuring that the hard work that we do and our mission advances across the globe, and it's my great pleasure to welcome her here today. Amira, thank you for joining us today.
Thank you. Thank you very much, Pauline, and hello, everyone. It's a real honor to be part of today's webinar. I am myself a proud member of the International Menopause Society, so even more delighted to be part of this discussion today. So as Pauline mentioned, I'll be addressing today the topic of the women's health gap as well as the menopause gap, and we'll be sharing a set of slides. Before I dig into the content with regards to women's health specifically, I thought I would provide a definition of the World Economic Forum. For those who are not familiar with the World Economic Forum, we are an international institution that promotes public-private partnerships. In other words, we bring together the decision makers who have the will and power to advance a specific topic. We bring them also around the same table at the right time. And we all make sure we have a common vision, which is to improve the state of the world. So now digging into the women's health gap. And before I share actually more information into what we do, I'd like to just spark one question to you all is, what is your definition of women's health? And saying that, and while you reflect on it, I would say myself, before actually engaging into this, the women's health space, I had a very different definition of what I have now. And even last week, I was on a call with a former CEO of a very large company who they admitted by, before joining the Alliance, they actually have a definition on women's health tied to sexual and reproductive health. So what I'm asking us today is really to maybe embrace a different definition to women's health to what we usually hear, to move past what we call the bikini science, and to not only think women's health as, would say, sexual and reproductive health per se, which also included, but to embrace a broader definition. And the way we define it at the World Economic Forum and with the Alliance, which I believe is a consensus amongst women's health and global health experts, is by looking at three different angles. The first one, women's health, is about sex-specific conditions. Menopause, endometriosis are conditions under this category. Then conditions that affect women differently. Women will react differently when they experience a heart attack. So they will have different symptoms, for example, and conditions that affect women disproportionately. There's a higher prevalence of Alzheimer, amongst women. So that's really looking at the broader and the holistic definition of women's health so that we are able to better address the different health challenges women are facing. So now the next question is, why is it important for us to address women's health? And we have different priorities here. The first one is women spend 25% more time in poor health than men. So while we recognize that over the past 2 centuries, the rise in life expectancy for both men and women has significantly improved, what we know now that it's not necessarily the full picture. Our research shows that women spend approximately 25% more time in poor health than men and with degrees of disability. So that really affect their health span. And here the interesting thing is to bring the concept of health span versus lifespan. So that's why we need to address women's health. The second reason why we should address women's health is by investing into women's health, we are actually able to contribute and to improve smarter science for all humanity. So we know that women are underrepresented in medical research, even from conditions that impact them the most. We also know that 70% of chronic pain sufferers are women. 80% of pain studies are done on men or male mice. So in all together, we also recognize that men's health doesn't stand apart. When research is sex blind, when early life care is neglected, or when maternal health is underfunded, we also see that men also face weaker treatments, higher risks, and lost potentials. So looking at women's health is good for human biology. Then the next reason why we should be addressing women's health, it's about de-risking future generations here. We have seen that the implication of women's health is broader than just the pure science and biology. The data shows that the more we invest in women's health, the more it actually benefits families, communities, and societies. Investing in women's health is investing in the future of the different generations by providing them access to improved health, more economic opportunities, and better lives overall. So that's really another reason why actually women's health should be a priority. Then the final reason why women's health should be addressed, it's because it's simply 1 trillion opportunity. Our research shows that if we are able to close the women's health gap, we'll be able to boost the global economy by 1 trillion per year, which is significant. It's another evidence that by investing in women's health, it actually benefits the GDP of the country. And closing the women's health gap is also about adding healthy days, 7 healthy days per woman per year. It's also additional healthy days for every woman over their lifetimes. And it's also about more women accessing full-time positions as, good health significantly impact economic opportunities. Now, addressing the Global Alliance for Women's Health. The reason why we decided to form and to launch the Global Alliance for Women's Health is simply to help close the women's health gap, as I mentioned earlier. And the way we do that is by bringing together different stakeholders who have the different capacities, who have the expertise, the resources, the investment that are needed so that we are able to make changes in this important space. So our vision is really for all women to have access to affordable and quality healthcare when they need it, where they need it. So those are the priority for the Global Alliance for Women's Health. And now, how do we actually work on the different priorities more on a concrete perspective? So our work is being structured and developed to respond to the different women's health gap. Our research shows that there are 4 different root causes for the women's health gap: the data gap, the care delivery gap, the research gap, and the funding gap. So we are working with different partners. We are working with different stakeholders who are able to bring, as I mentioned earlier, the knowledge, the resources to help advance those different topics. I'll give you the example of the care delivery gap here from this slide. You will see that we are working closely with the Health Ministry of Kenya to advance and to eliminate breast and cervical cancer in Kenya. And we do that by improving the capabilities and training healthcare promoters and healthcare workers in Kenya so that they are better equipped to with regards to diagnostics and early screenings for cancer. So those are the type of contributions that we are able to make on the ground thanks to the different members and partners of the Alliance. The other work that we are doing is on maternal health in Nigeria, and we are closely working on a federal level in Nigeria to help improve the access of commodities so that women are able to access the right services that they need at the right time. And this really goes with being able to access quality services and commodities. So I won't go through all the different engagement opportunities and initiatives through this slide, but this gives you really a high-level idea on how we operate at a concrete level and how we engage the different stakeholders that we have. Now, I wanted to pause for a moment and dig into the menopause topic. And I must confess that this is really a topic that's close to my heart because I have started myself the perimenopause journey a few months back. And I can tell you this has been quite an experience. And it's actually, as mentioned in this slide, a life-changing experience. It's far from being just a normal, I would say, journey. It actually, the implication of perimenopause, menopause are quite high. And what we know is that menopause is expected to be a normal transition for women in midlife. However, in reality, it's quite different, and it does affect, our data have estimated that it does affect more than 450 million women worldwide at any one time, which is extremely significant. We know that the long-term effects of menopause and untreated symptoms lead to many increased risk, whether it's on chronic condition, whether it's on cardiovascular disease, whether it's on type 2 diabetes and other gynecological conditions. So the impact of menopause, I believe, are even underestimated at this point of time because little data and little research is happening in this space. And what we know and what we are hoping to change the course here on menopause is that actually when we look at the economic gains of closing the menopause gap, our research shows that there's a potential estimated gains of 2.4 million annual dailies, but 120 billion US dollars in annual GDP in the women's health gap, which is significant. It's one of the highest economic opportunity if we look at all the different conditions reaching to the 1 trillion opportunity. So I think there's really an opportunity for the community to address this challenge by looking at different data, whether it's a daily perspective, whether it's economic perspective. There's really, I think, increased interest, increased opportunities to just open conversations. And I also wanted to share some data around the impact that menopause has for women in the workplace. From our research, the recent research, we know that 1 in 4 women have considered leaving work during their menopause transition. 1 in 4 women is quite significant, right? 1 in 10 who have worked during menopause left a job due to their symptoms. 40% have gone part-time, and 8% have not applied for promotion. This tells a lot on how the menopause condition has a direct effect into the economic opportunities, into the career of a woman. So that's really certainly something that should be elevated, should be addressed, and should be discussed so that we are able to find solutions in that regard. So now if we look at how do we do with the menopause gap, if we align with the structure of the alliance, we may need to address the data gap. We may need to look at the care delivery gap, the research gap, and the funding gap. And we know that there's limited data when it comes to menopause. So what needs to happen in this space so that we increase knowledge, we increase information, evidence in this area so that we are able to take informed decision. We are able to take the right policies so that really would start with increased access to data with regards to menopause. Then the care delivery gap, I think this one is also a very interesting one. I was recently, went to my GP and shared a few symptoms as I was, entering my perimenopause phase. And the feedback I received, but all women are, experiencing that. But we don't know, etc. So I wasn't able to find the right approach. So I would say here there's really some work that needs to be done in terms of transforming care delivery practices and services so that we address the 75% of women who are left untreated when seek help for menopause symptoms. It's a very important one. on this one. The research gap is also a significant one. We know that, as I mentioned earlier, it's affecting 450 million women. However, funding research into that space is still very limited, and it needs to be increased. It needs to receive more attention and more funding so that we have increased research in this area. Then the last piece around the funding gap, as I mentioned earlier, we know that it receives less than 1% of women's health funding in many regions, and the limited investment are actually reflecting in the lack of awareness campaigns and workplace support in this space. So I think we all agree that with regards to women's health as well as menopause, we need more alignment, more investment, and increased awareness into that space. It starts at the global level when we work with policymakers, with decision makers, and all the private sector organizations, but it can also work at an individual level. So I would say I would recommend invite anyone to continue the conversation individually, amongst your network. It doesn't stop here, and we are hoping that by increasing just the awareness, make it opening conversation around those different topics, we'll be able to really move the needle and make progress with regards to women's health overall. Over to you, Pauline.
Wonderful. Thank you so much, Amira, for that broad perspective on women's health and what I found to be such a helpful quantification and delineation of the scope of the problem. We're going to move on now to Dr. Anna Bode, and then we will come back to you for the Q&A. So thank you. It's now my great pleasure to introduce Dr. Anna Bode. She will be speaking about prescription for change policy recommendations for women's health research. Anna is a principal at Kearney's Healthcare and Life Sciences practice with a PhD in neuroscience and over a decade of consulting experience with leading global biopharmaceutical companies. Anna has developed deep expertise in commercial strategy across the entire pharma value chain. She's also an active member of Kearney's W Health Team, a global platform dedicated to advancing women's health worldwide. Currently, she is assigned to the World Economic Forum's Global Alliance for Women's Health, which we've just learned about, with the ambition to transform the women's health science and innovation policy landscape. Anna, welcome.
Thank you very much for the kind introduction. So great to be here today and to speak about such an important topic, and also a topic that is very close to my heart as a woman, as a scientist. Yeah, it's great. Thank you. So yeah, I'm here today, and I'm speaking on behalf of Kearney, but also on behalf of the World Economic Forum, because I'm actually currently seconded to them and working very closely with Amira, especially on the topic of science and innovation in regards to women's health. And yeah, we believe it's a very important topic because investment, especially in women-specific conditions, is very limited. So it's underfunded, right? With just 7% of pharma R&D spent in 2024 going into it, and 6% actually in women's cancer. So there's less than 1% or less than 1% left for other women-specific conditions, important women-specific conditions like endometriosis, PCOS, heavy menstrual bleeding, or we should probably say too heavy menstrual bleeding. So yeah, women's health is underfunded, but is also under-researched and underrepresented. When we look at the inclusion of women in clinical trials And yes, it got much better over the past decades, from basically no inclusion at all to better inclusion. But we still believe we need to get better, and especially when we look at certain subpopulations like pregnant and lactating women. So when you look at the drugs labeled for the use in pregnant and lactating women, it's just 5%. And yes, I know it's like there are also safety related issues to it, but we still need to understand it better. And there are huge economic returns. I mean, Amira was just speaking about the 1 trillion opportunity that we actually have by closing the women's health gap. So we felt like we need to do something about this. And when I say we, I mean the World Economic Forum with Amira, I mean Kani, I mean the Gates Foundation. And I'm also referring to this amazing working group here that we pulled together to look into the topic. And this working group consists of regulators such as EMA, MHRA, Health Canada, of industry representatives such as Merck, MSD, Sanofi, and Roche as well, and others, and like other important organizations. I mentioned the Gates Foundation, National Academy of Medicine, World Health Organization, etc. So you can see quite a few logos here. And we came up with the ambition to transform the policy landscape in women's health research from this very limited physiological understanding that we have right now to a real focus on sex-specific science and medicine along the 5 pillars that you can see here. So starting with innovation in women's health. And when I mean women's health, I mean the conditions that affect women uniquely, but we also mean the conditions that affect women differently, like cardiovascular diseases and disproportionately bone health related issues, brain health related issues, etc. Then secondly, we said we need to get better in regards to the inclusion of women in clinical trials. And as said before, like women in general, but then also like different subpopulations like women of color, postmenopausal women, Amira talked about it, pregnant and lactating women, etc. And we also need to disaggregate the data from clinical trials by sex. We also need to think about how we design clinical trials and always have women in mind. And once we have included women in clinical trials and disaggregated the data, it's also a question about the insights on sex-specific differences that we generate and what we do with those insights. So yeah, lots of things to do. There are certain incentives for it, certain requirements. It's probably also a question about representation of women in research leadership. So yeah, we put our heads together and actually came up with some policy recommendations to transform this women's health research landscape along the 5 pillars that I just outlined. And yeah, we believe that we need, in regards to the first pillar, innovation in women's health, we believe that we need to start with the introduction of regulatory incentives like priority review vouchers. We need to create financial incentives to drive innovation in women's health, like tax credits. Very similar actually to what we have seen in the rare pediatric and orphan space a while ago. And maybe we even need to think about like a new pricing and reimbursement value proposition to drive innovation in women's specific conditions specifically. So that's the first pillar. The second pillar, focusing on the inclusion of women in clinical trials. What we believe here, what we need to do is to, first of all, create awareness with regulators and investigators to generate women-specific data earlier. And it's probably a quick win to create this awareness and educate them. But then it's also very much about incentives and requirements. So requirements, for example, in regards to the improving enrollment of women in clinical trials, and not only women in general, but also by race, by ethnicity, by age, very similar to what we have seen in the FDA's diversity action plan. And then it's especially for pregnant and lactating women, we need to think about like potentially introducing a maternal investigation plan to require research in those populations, but to at the same time to also incentivize it. And here we believe that the pediatric space provides a great example because they had like issues as well of including in women in clinical trials, and got much better with certain incentives and requirements. Then the third pillar is around data disaggregation of clinical trials, and here we believe we first need to start with terminology and data collection standards. For example, a clear distinction between sex and gender, and maybe we also need to add additional insights such as the socioeconomic status. And then it's really about disaggregating data by sex and requiring comprehensive sex-specific benefit risk assessments that also look at race, ethnicity, and age, and that are just updated on a regular basis once new data comes in. And yeah, with the very limited data that we have for certain subpopulations, we need to think about how can we maximize insights, for example, adopting flexible methodologies for analysis, starting to share data globally across regulatory agencies, etc. Fourth pillar is around the design of clinical trials. And when I mean design of clinical trials, we probably need to start earlier. We need to think about how can we best employ sex-specific biomarkers to understand differences in disease mechanism and manifestation. And then when we design the actual clinical trials, we need to account for sex-based difference. And maybe we even need to design trials differently for men and women, like different endpoints or something, if we have seen differences in prior studies. And in addition, we need to educate everyone who's involved, investigators, developers, clinical trial staff, patients, etc. Plus ensuring access for like those diverse women that we would like to include in the clinical trials, and look at certain barriers they have, like childcare, like transportation, like financial insecurity. And then final one is the one on insights on sex-specific differences. And here it's really about reporting sex disaggregated data in scientific publications to improve transparency on insights. And yes, you've probably all heard about the SAGE guidelines, and they are great, but not everyone follows them. So it's not good enough to disaggregate clinical trial data. We then also need to report it and speak about it. And we need to update clinical guidelines accordingly, and also ensure that we create transparency for patients in leaflets and inserts. So yeah, this is in a nutshell what we have put together with our working group, and we have actually written a white paper on those policy recommendations that we published earlier this year at the World Health Assembly in Geneva. And yeah, if you are interested to read more about it, to download the full white paper, you can scan the QR code here. And yeah, thank you very much for your time and for listening to this important topic.
Thank you so much, Anna. Thank you, Amira. We'll now move into the Q&A. So I would ask people who have questions to please put your questions in the chat with your name and your country of origin. I'll just point out to our guests today the range of countries that we have represented here. And this is an implicit thank you for all the work that you're doing on the global stage. We have Canada, Argentina, Guyana, Bangladesh, Norway, Rwanda, Portugal, Brazil, England, the Czech Republic, South Africa, the US, Vietnam, Australia, etc. So we have a really beautiful representation across the globe. And just want to thank you for all of your work on the policy side and on the, if you will, argument side for why menopause matters. It matters to all of us who are working on the ground across the globe to try to improve the lives of women as they transition through the menopause. I'd like to start with a question for Amira, if I could, please. And this is from Alexandra Solheim, and she's the leader of the Norwegian Menopause Society. And she had a question about the McKinsey report. In it, kind of the difference, if you will, between the $1 trillion number and the investment needed. So we have this number that we have this $1 trillion opportunity. And the question is, do we have an understanding of the investment needed to move the needle on that, particularly for each at a country level basis? So if the return is 1 trillion, what's the cost of the investment? Or how do we begin to think about the cost of investment? Are there any test cases, for example?
That's actually a very, very good question. And I may respond by the way we actually look at the calculation model that we brought together, reaching the 1 trillion figure. So we actually look at the health gains and the economic value. So, we looked at those different dimensions. And which are translated into the fewer early death. So how, women are surviving, or what are the lost economic contributions to that. So that's the number one indicator that we looked at. The second one is how, closing the women's health gap contributes to less health condition, more looking at the disability angle for it. So how are we able to reduce the disease burden so that, for example, increases productivity in the workplace? And also, we know that, I shared the example of the menopause symptoms and the impact it has on women in the workplaces. If we're able to address the menopause gap, how much women are able to stay in the workplace and then contribute to the GDP of the country. So I know it doesn't necessarily address the investment required to it, because we didn't base our model towards that calculation. But that certainly it's something that will need to be added so that we better understand what is the investment required versus the net gains actually. But we believe that focusing at first on with the 1 trillion figure, it gives incentive for us to open conversations so that we are able to address the investment that are required across the different causes for the root gaps, across the different countries, and across the different conditions. So that's certainly a phase 2 approach that will need to be brought.
Thank you. I would say too, I think it's incumbent upon those of us in the field who do work on things like menopause policy in the workplace to actually do the hard work of calculating the return on investment and helping WEF and the Global Alliance to really make a case for the investment. So I know there's a lot of efforts going on menopause in the workplace, and there are certain countries I think that stand out, the United Kingdom being one of them. I do think that one of the ways that we can help each other is by really getting hard numbers from quality research studies that quantify that return on investment. And I know I've been searching for a test case. Amira, you may have one. There are a lot of companies doing a lot of good things, but I'm not sure that we have quantified that return on investment.
No. And I may add into the chat as well a link to the Women's Health Impact Tracking platform that we launched earlier this year, which won't give necessarily data around the investment needed, but more on breaking the 1 trillion into the 9 conditions that we pre-selected that represent 400 billion out of this 1 trillion. And it also breaks into different countries that we pre-selected. So this might give maybe more information, more data towards that question.
Yes, thank you. So the nation-based data is available online. Thank you for that. Okay, Anna, when we think about the large scope of work that we have to do to move the needle in women's health, sometimes it's very helpful to think about success stories. So what's worked? And I wonder, do you have some success stories that you can share in this space that might represent the kinds of activities and initiatives that we can begin to think about globally?
Yeah, I mean, when I speak about success story, I had it a little bit in my presentation as well, right? Because within like the science and innovation setting, we believe that we can actually learn from other areas, things that have worked for others well. I think the two most prominent examples are here. On the one hand side, how can we best drive innovation and create regulatory and financial incentives, and that's clearly something that we can learn from the orphan space and maybe also the rare pediatric space. And then when we think about the inclusion of women in clinical trials, I think the best example where we can learn from outside of the inclusion of women in clinical trials is actually the pediatric space. They have been so successful 2 decades ago with pediatric investigation plans, with requirements to do studies in pediatrics, also with providing certain incentives. But by the way, they were much more successful with requirements than with incentives. I think that's something we can definitely learn from by looking outside of like women's health, basically learn from other areas.
Thank you. Amira, a question for you from a colleague in Sweden. What do you see as the single most urgent action, whether in research, clinical care, or policy, that could most effectively close the global health gap for women in midlife and beyond, especially in under-resourced settings?
I wish there was a magic answer to it, to be honest. But I would say when we open conversations on what is a priority, and especially in LMICs, is the resources topic, the investment that is required to increase access to essential commodities or to train the local workforce. And we cannot do any of the different programs. We cannot reach communities if we don't have the right investments. And one way that we do it within the Alliance, and I didn't cover it in the overview of the Alliance, is by looking at 2 different fronts. The first one is how we can bring together the community of private investors. So the JP Morgan, the Mubadala and others, so that we actually build an investment thesis so that they understand that if they invest into women's health categories, it's also a profitable market. So always coming with economic angle, we need to understand that it's also for the benefits. And it works because we see increased interest. They are coming to the conversations, and we'll be releasing the very first Women's Health Investment Index at Davos with all the different data. And the second piece is we are bringing together different finance ministers and health ministers with a target of the African region. And the idea is to come up with a new financing model and framework so that they understand at a country level, we'll have pilot countries, at a country level, the model for them to prioritize and increase the budget towards women's health, and how much it actually benefits the countries in terms of GDP. So investment is a key topic, and it's certainly where we might want to start.
Thank you. I have to say, we have a number of colleagues around the world who are working at policy in their individual countries and regions of their countries. And I have to thank you for giving us the financial argument, because when I say there's a $120 billion opportunity in menopause in annual GDP, suddenly people who didn't care about menopause say, what? And then you think about, happens to all women who live into late life, and we're half or more of the population. So thank you for that. And let's move on to another question. Anna, when you work in these spaces and you're trying to affect change across the globe, and you showed us your image of all the partners that you bring together, how can we who are on the ground and working with women or in the research space begin to understand, how do you assemble the teams that you bring together? Who needs to be at the table to affect change?
Yeah, so I believe, is there an echo? No, I think it's okay now. So I believe it really needs to be a collaborative effort across the healthcare ecosystem, because when you, for example, look at the open letter that Kani published beginning of last year at the World Economic Forum in Davos on redesigning healthcare with women in mind, and you look at the different pillars that we outlined, it really goes from research to care delivery to education to investment to policy to data. So it goes across so many different areas, which means we really need to bring the entire healthcare ecosystem together, and maybe even beyond, right? So for example, we as Kani also work together with companies like Microsoft, because they can bring in the data, technology, artificial intelligence angle. So yeah, for me, it's a collaborative effort. We all need to work together, and especially in the science and innovation field, what I showed you in our working group, I think the most important players are like the regulators, and the industry representatives that really need to come together and find solution, and probably also governments, because we need a little bit more investment.
That's for sure. Great, thank you. We have a couple of questions from colleagues in Argentina, and my colleague Karen Giblin from the Red Hot Mamas USA. Karen, thank you for all the work you've done over the decades to raise awareness before menopause was popular in the United States. The question is about information. So what are we, empowering women with information is a really critical first step to addressing this gap. So how do we think, how does the World Economic Forum think about how do we develop educational programs and resources that can improve menopause literacy and translate into enhanced quality of life and health outcomes for women? What role can WEF play in that?
Mm-hmm. That's a great question. So I would say where the forum would have the highest impact is by advocating for women's health and menopause at the highest political and global platforms. And this is where some of the discussion need to start. I'll give you an example. The 1 trillion opportunity report that we launched, and the data that we know 25% of our time is in poor health, have made it to big platforms, to the G7 platforms, G20, but also reaching the public audience, because we've seen, for example, Oprah Winfrey sharing about our data and also opening discussions around that. We've also seen on these platforms new discussions around menopause. So I would say where we would have the most impact is by equipping policymakers, decision makers, and influencers of the world with the right data, with the evidence and the tools, so that the information can be disseminated. And then working with you, Pauline, and the International Menopause Society to align efforts and see how we can reach communities, how we can reach women directly. So I think it's really by straightening our efforts and our messaging, our narrative on the global and political platforms. We would start with that.
Thank you. I would just highlight a success from Dr. Beatrice Neufeld from Limerick. The incentive in Ireland is that since June of 2025, menopausal hormone therapy is now government funded and free of charge to women. So thank you for sharing that success. A question for Anna. Beyond gender, is there research looking into menopause amongst minority populations like the ethnic minorities in Asia, Indigenous or First Nations people? And how do we think about funding these opportunities?
Yeah, so to be honest, I cannot fully answer the question whether there is like something already going on or not, but what we believe is important is that we do not only look at women in general, but really also like the different subpopulations, right? That you have like by race, for example, women of color, by ethnicity, by age, really having like postmenopausal women included in clinical trials as well. We believe that like those different factors and maybe even socioeconomic status or something is important when we design clinical trials and when we recruit women for those trials and develop like diagnostics, treatments, etc. And yeah, funding is not an easy question, right? Because it probably needs to be a combination, as I said before, of incentives on the one hand, right? That we are getting some funding to do those clinical trials. But on the other hand, as well, we believe that we need certain requirements, right? So also the industry developing the treatments or the diagnostic devices or whatsoever needs to commit to contribute to closing the gender health gap.
Thank you. A question from a colleague in Paris, Christine Seiler. Are there plans for gathering policymakers, corporates, patients, investors, and other stakeholders to create policy collectively anywhere in the world that you know of? Would this kind of summit be possible in Europe? Amira, what are your thoughts on that?
I feel like Christine has a great idea, right? That would be wonderful. I'm actually wondering whether there's such a platform already existing. There's certainly different webinars, different discussions, more at a global level on menopause. I've been invited to some of them. But I like the idea of, the policy angle to it, addressing the policy changes that need to happen with regards to menopause. A lot of discussions are happening into the, femtech space. What are the different solutions in this regard? But the policy angle is absolutely something that's important. And yeah, I would strongly support Christine's idea.
And I like the idea of Europe because I believe that Europe needs to have a much stronger role going forward, because with lots of things, I feel like the US was leading quite a lot, but now I feel like Europe also needs to play an important role.
Yeah, thank you. I think the momentum in the United States is coming at the states level. So we're going to be in California advocating for a menopause bill. And, if we have some of the larger states paving the way, let's hope that it's a good contagion. A question from my good colleague and friend, Nicole Jaff, who's also on the Board of Trustees of the IMS. So Dr. Jaff is in South Africa, and it's hard to make the economic case for menopause or the case for studying menopause when, if you will, there are other competing concerns, right? There's HIV, TB, drug resistance, TB. So how do we begin to make that argument? How can we begin to talk to key stakeholders, government and policy, when there are these other concerns that have gotten a lot of attention? How can we bring that back to women's health?
Should I go first, Anna?
Sure. Yeah, thank you.
Well, I can only, agree with that. When we, work with different countries such as Nigeria and Kenya, I mentioned earlier, the first priority topic that they would like us to collaborate on is maternal health, women cancer. Menstrual health is a topic that's coming as well as a priority. So menopause hasn't really been a priority when we spoke to the stakeholders in this region. However, I think the way we can reverse the situation is by addressing the health and economic impacts of menopause in these regions. So that we come up with an evidence-based approach with the data, so that we are able to increase awareness on the implication and therefore come up with potential policy changes and solutions on the ground. So a lot need to be done in that space, but we might know how to address this. We just need to, just open a few conversations at first.
And any further thoughts on that?
Yeah, for me, it's a policy topic, right? So it really needs to start at the top, and people need to be like, it needs to be clear that at some point it will affect every woman at some point in her life, right? And I'm not sure whether this understanding, it's so simple, right? But I'm not sure whether this understanding already exists. And I believe this really needs to start at the policy level, but then also education wise, because my understanding is, like, when I look at like some medical curricula here in Europe, menopause is not a big topic yet, right? And that I believe also needs to change.
Thank you. Julia from BT Congress, we have a note in the chat saying that the SurveyMonkey link is unclickable. And if you could please post it in the Q&A, that would be super helpful. So some other six. Yep.
Pauline, maybe one thought on this specific question.
Please.
The other opportunity that we may want to bring is the workplace angle on how much it affects women in the workplace, and then affect the productivity of the organization. So this issue is applicable in all countries. So this is certainly something that we can bring on as a potential solution.
Thank you. And as an example of that, we have a colleague from Trinidad and Tobago who's doing her PhD and working with the Ministry of Labor to design and publish workplace guidelines to support employees experiencing menopause. And she managed to get funding from the European Development Fund for that. So congratulations. I love sharing these success stories. Wonderful. So how do we, final question, how do we begin? Oh, actually, we're at time. Sorry. So I know, Anna, you have a very hard stop. So I'd like to thank you very much. Thank you to all of our colleagues from around the globe for gathering here today. Thank you to both of you for all of your work to try to help us help other people. We look forward to engaging together in other opportunities to move this work forward in our shared mission. What I'd like to do is now, if I could turn it over to BT Congress, I'll finish out with the final slides. We do want you to please complete the survey link. I hope it gets pasted into the Q&A here. Here are just some of the many educational opportunities offered through the International Menopause Society. We encourage all of you who attended today to access these to move your mission and work forward. Next slide, please. We encourage you all to be a member of the IMS, just like Amira. Thank you, Amira, for that shout out. We offer a free one-year IMS membership with completion of our menopause education initiative, our IMPART, which is applicable to healthcare professionals working in or with a special interest in midlife women's health. It provides comprehensive training for healthcare professionals in managing acute menopause symptoms and the long-term consequences of the changes that occur at menopause. So please avail yourself of that opportunity. We have IMS membership offers in partnership with local and regional societies who are members of our more than 66 councils of affiliated menopause societies around the globe. Many are represented here. Thank you so much to our CAMS colleagues. We have monthly live events like this one here and a library of educational resources. This will be posted on YouTube. and you can find out more at ims.org. Finally, we hope to see you all in beautiful Rio de Janeiro next year at our 20th World Congress on Menopause. That's September 30th to October 3rd. Please join us there. We get bigger and bigger, and we love seeing you all in person and sharing these. And maybe we can brainstorm about opportunities there to discuss policy too. So thank you so much to our speakers today. Thank you to our colleagues around the globe. Thanks for everything you all are doing to help women around the globe. It's been a great pleasure to host you today. Okay, be well, everyone.
Thank you. Bye-bye.
Thank you.
And don't forget the survey. Okay.